This is Dr. J from LifeSpine Health Enhancement Center. Every year we treat dozens of patients for injuries sustained during motor vehicle accidents. However, we found that there's a big misconception about the level of injury being correlated to the amount of damage seen on the vehicle, and that just isn't true. As a matter of fact, the higher amount of damage seen on the car usually is a sign that the occupants were protected. Vehicles are designed nowadays to have crumple zones, and those are to absorb the amount of energy during the collision in efforts to dissipate that energy and protect the occupants from injury. Now let's think about it from the other side of the coin. If you have a accident that happens at lower speeds, maybe from 5 to 10 miles per hour, there may not be a lot of damage to the vehicle. And people mistakenly see this lack of damage to the car as a lack of damage done to the bodies, but that could not be further from the truth. And oftentimes, the pain and symptoms that happen from a car accident usually don't show up for 2 to 4 weeks after the accident. So even if they do show up, the person doesn't seem to correlate it with an injury that actually happened weeks prior. And there's a lot of reasons for that to happen as well. But my purpose of this video is to share with you that misconception, and hopefully we can break down the barriers. And I want to tell you guys that if you've been in a car accident, whether it was a couple weeks ago or a couple years ago, if you weren't thoroughly examined by a chiropractor, please do so, because there may have been some injuries to the delicate joints of the spine that have been left untreated. And if that process goes left unchecked for many more months or many more years, that's predisposing you to more complicating injuries down the road. So once again, this is Dr. J from LifeSpine Health Enhancement Center.